Welcome back to Sculpting the Soul, where we explore the art and science of transformative plastic surgery with the renowned plastic and reconstructive surgeon, Dr. Kalus. I am your host, Neil Schulman. We have an exciting and insightful discussion, as always, in today's episode. We will be delving into the topic of a mommy makeover, what that means, and what are the most common effects of pregnancy on a woman's body, which I'm sure there are many. Dr. Kalis, as always, we are so thankful to have you joining us today.
Thank you, Neil. Pleasure to be here.
Of course, it's always a pleasure to have you in our studio and talk about these things. As a mother, your body undergoes many changes with pregnancy and breastfeeding. As a woman, I probably don't need to tell you that. But we will be discussing today why women consider mommy makeovers, the remarkable benefits that they can expect from them, and how this transformative journey can help restore not just their bodies, but also their self-esteem. And we'll talk so much more about that in detail, Dr. Kalis, but let's just start with the very definition of mommy makeover. What does mommy makeover mean to you and to our listeners, do you think?
Thanks, Neil, for that question. Well, it actually does mean different things to different people, but as a general statement, most women, I think, and most plastic surgeons usually think about a mommy makeover as a surgical treatment plan that involves addressing the changes both in the tummy and the breast, which are the most commonly affected aspects of the body with regard to pregnancy. But, there are also weight changes with pregnancy. Unfortunately, it's very challenging for a lot of moms to get back to their pre-pregnancy weight. And that may mean other areas of the body that may benefit from some body contouring. So there's no one single definition for every patient that in a cookbook, cookie cutter sort of way says, this is a mommy makeover for everyone. And what we do, as with any patient who comes to see us, is the first thing we do is listen to our patient. And patients are very clear, and moms are very clear about what is bothering them. Their breasts, they may have lost some breast volume. They may have been quite satisfied with their breasts before pregnancy, but after nursing one or two or three kids, they may find that their breasts are a bit saggier. They may have lost quite a bit of volume, and that might mean addressing both sagging and volume, whether it's a breast lift or a breast augmentation. We can get into that in more detail. With regard to the tummy, there may be stretch marks, there may be loose and saggy skin. With regard to the rest of their body, they may have filled out in places they wish they hadn't, and that might be addressed with liposuction. And then most of our listeners, I would say, Neil, are thinking about the body as far as mommy makeover, but I don't want to ignore the face. And what I mean by that is if a mom has been her devoted self to her children, whether it's at infancy, she knows that there are going to be some sleepless nights, and that can result in maybe some worry lines with regard to frown lines between the brows, maybe some sagging and bags around the eyes, and none of these things necessarily need to be fixed. What can be addressed in our office is whatever it is that the patient seems to be bothered by, and that's coming back full circle to what I said a moment ago. The patients and moms certainly know what is bothering them if they look in the mirror, whether it's their face mirror or their body mirror, and 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 they know what to ask us with regard to what can be done about whatever their concerns might be.
So you just touched on a potential answer to the next question, but I'd like you to expand on it a little bit more. What are some of the most common reasons that you believe women will consider a mommy makeover after giving birth to their child?
Right. Well, I'm going to answer that circuitously. The first thing I want to tell you is that whatever we come up with as far as a surgical recommendation or treatment plan, the other thing that's critically important is timing. And if a young mom has a 6 week old or a 3 month old and she's bothered by X, whatever X is, her tummy, her breast, whatever, the first thing I'm going to ask her is, are you done having children? Because whatever we do surgically may get to a certain degree undone by a second and third and fourth pregnancy. So we really want to address that. And we want to remind all moms that the gift that they have of their beautiful new child may have been worth a little bit of sagging or a little bit of loss of breast volume or whatnot. And by the way, the changes, if we're going to go talk about it specifically, Neil, when we talk about the breasts, all bets are off on predicting exactly what will happen with any given woman. In other words, a fairly normal breasted woman who gets pregnant, almost all women are going to notice breast changes with regard to their breasts getting fuller and larger with pregnancy. But some women, after the fact, will lose some of their breast volume and go back to being even smaller than before pregnancy. Some will be about the same, but maybe a bit looser and a little bit more sagging. And some might have gotten bigger and stayed bigger. So we address each patient individually with the individual and specific concerns that she might have.
What do you think is the most typical what what most typically comprises a mommy makeover procedure and how it addresses specific post-pregnancy concerns?
So we did touch on what happens with the breast, and if the uh, patient has concerns both about her tummy and her breasts, depending on what we're doing, almost everything can be done as a two procedure simultaneously. In other words, if she's a good candidate for a tummy tuck or an abdominoplasty, where we're getting rid of the extra loose skin, the overhang, if you will, there might be a little fullness in the pubic area that may benefit from some both lifting, tightening, some liposuction. That can almost always be done at the same time as, for example, a breast lift or a breast augmentation. It just depends. A lot of our moms might already have been augmented because a lot of women have undergone breast augmentation in the past. And if they're coming back larger breasted, but now with the implant not in a good relationship to the breast, that might become a little bit more complex with regard to the breast surgery. We may need to remove the implants. We may need to downsize them. We may need to combine that with a breast lift. But as a general statement, I think it's fair to say that most plastic surgeons and most patients are thinking about a mommy makeover as some combination of two procedures, namely, most commonly, a tummy tuck with a breast addressing operation, whether it's an augmentation, a lift, or some combination.
And just to be clear, the medical term for tummy tuck is abdominoplasty.
Correct. And the medical term for a breast lift is a mastopexy. And of course, breast augmentation, that's a pretty common term that most women are familiar with.
Sure, of course. Well, you did just sort of touch on what I wanted to get to next, but I wanted to go a little bit deeper into the self confidence and body image portion of this discussion. How does a mommy makeover help restore a woman's self confidence and self esteem and body image after having children?
So one part of the body we didn't talk about yet, and this is a sensitive subject, but um, the in a live birth, a vaginal delivery, there are going to be changes not only from the pregnancy in the tummy and the breast, but it could also affect the vaginal canal. And the operation called labiaplasty, some women will have either excess tissue in their labia minora, which are the inner lips, and that can sometimes worsen or exacerbate with a natural birth delivery. And that might be an issue with regard to discomfort or embarrassment with certain clothing, bathing suits, tight jeans, and it can also impact functionally in terms of causing significant discomfort with intimacy and intercourse. So that is one other component potentially of a mommy makeover, and I just didn't want to ignore that. But your question related to how this can really improve self-esteem, is that correct? Well, I think it's fair to say that if a woman was happy with the way she looked before she had babies and she felt sexy and attractive and she felt good with her weight, all of that might have changed with a pregnancy. And I want to be very clear, Neil, any changes that occur in a woman's body do not automatically need to be corrected. I want to emphasize the fact as a plastic surgeon, I am here for the patient who needs me. But I'm not in any way trying to imply that in any woman whose body has changed as a result of pregnancy needs to do something about it. She only needs to do something about it if she wants to do something about it. And she will want to do something about it if she's noticed that her psychological well being and self esteem have been affected by the fact that she doesn't look or feel as sexy as she was before pregnancy, as an example. And it doesn't just have to be sexy, you just want to feel good about the way you look. And so, any woman who has noticeable complaints in regard to the areas of the parts of the body that we've discussed might potentially be a candidate for addressing some of these things.
Well, you just touched on something else that I wanted to get into more detail, and that's about feeling good about the way you look. So, obviously, there are physical changes that women undergo when they deliver a child, and then there are physical changes that are undergone when the surgery is completed. So, what are some of those physical changes that women can expect during or following a mommy makeover, and how do you think these align with their aesthetic goals?
Great question. And I think, again, it touches on realistic expectations. I think there are changes in the body from pregnancy that are absolutely permanent and irreversible. And so, the 30-year-old mom of two or three kids who is looking to get her 18-year-old pre-pregnancy body, I don't think that's realistic. Although I'm proud to share with you and happy to share with you that the vast majority of our mommy makeover patients usually find that their expectations have been exceeded. In other words, we may find a situation where a tummy tuck or a breast augmentation or a breast lift may give her a body that she feels she never even had in the first place, irrespective of the pregnancy. So, again, Neil, I would say that our goal is to address each and every patient as an individual with her concerns and specifically address what expectations are considered realistic and what might not be realistic. And we can dive much more into that detail specifically with regard to breast size and implants and breast lifting and so on. A certain amount of sag will occur in any woman whose breasts have undergone the changes of pregnancy. And whatever tightening we can accomplish will, to a certain extent, always have an element of relaxation after the fact. We always remember, Neil, that we're operating on patients, people, not mannequins. We're not creating sculptures or statues. We're using the body's own tissues, which have movement, which have blood supply, which have collagen and elastin, which is going to stretch and respond to weight fluctuations and movement and muscle building and so on and so forth. So that's the sort of exciting yet uh, fulfilling challenge of doing what we do. I don't want to sound sort of arrogant about it, but I really feel as though we're sculpting the body, and instead of working with stone or wood or clay, we're working with the human body, and we're changing the way it appears. And so that's what we do, whether it's by cutting or by liposuction or by augmenting with an implant or with fat graft. We have many, many tools in our toolbox to utilize in order to achieve the aesthetic and surgical goals for our patients.
Well, you just touched on the very reason for the name of this podcast, Sculpting the Soul. We are sculpting the human body. And it's important to, again, remember the human body, not mannequins, like you said,
Absolutely.
not dolls. We're talking about human bodies with emotions, with with brain power that can get affected by this. So I wanted to ask you about that next, because we just talked about the physical changes that women can expect. How about some of the psychological or emotional benefits that you've observed in certain patients after undergoing one of your mommy makeover procedures?
It can be absolutely life altering. And I think all of our listeners are going to be familiar with postpartum depression. Postpartum depression can occur in someone who isn't necessarily despondent about the way her body looks, but if the body has undergone some significant changes in the wrong category, in the wrong direction, that certainly won't help postpartum depression. So the idea, and not every woman who has who is coming to see us about Mommy Makeover has postpartum depression. I don't mean to in any way imply that. But, I think the changes that occur in a woman's body, as we mentioned a few moments ago, do not all necessarily need to be fixed or repaired. It's all a question of how good she's feeling about herself. And if she feels that the little pooch in her tummy or the sagginess of the breast is something she'd really like corrected, then that almost always has a solution. And thankfully in 2024, plastic surgery, soon to be 2025, plastic surgery is safe. It's extremely effective. It is highly predictable. Um, Anytime you're dealing with surgery, there's always a potential for certain complications, bleeding, infection, scarring, delayed wound healing. But thankfully, these complications are extremely rare. And when we plan a really good operation on a really good, highly motivated patient who both is already following a healthy lifestyle, eating well, exercising, not smoking, not drinking to an excess, and following our directions explicitly in terms of trying to be compliant with our instructions on the do's and don'ts after surgery, this usually is the perfect recipe for a very satisfactory outcome and a very happy patient.
You have a knack of anticipating my next question, Dr. Kalus. It's very, very intuitive. Maybe that's why you're a plastic surgeon. What kind of specific lifestyle factors or health considerations do you believe a woman should take into consideration or evaluate before choosing to go for a mommy makeover?
So I think I alluded to that a moment ago. I think every patient knows that a healthy lifestyle is really what's going to underline and bring out the beauty in all of our patients. If we are ignoring good, proper guidance on healthy eating and exercise, then the quick cure under the surgeon's knife is not always the best way to go. We have the ability to perform surgery, but timing, I alluded to that a few minutes ago, timing is also important, not only in terms of whether or not the number of anticipated pregnancies is already completed, but also weight loss goals. And if the patient is significantly overweight, we're going to try to get her either back to a normal BMI or her desired weight, even if it is a bit overweight. We're not punitive about body weight. If the patient is 10 pounds overweight but is absolutely maxed out on eating healthy and exercising regularly, we're not going to say, nope, we're not operating on you until you lose 10 more pounds. We don't do that. We address each and every patient. And remember, the hat that I wear, Neil, first of all, is a doctor hat. So the first thing I'm addressing is the patient's overall medical wellness, suitability for surgery, risk factors for surgery or complications. The second hat that I wear is the plastic surgeon hat, meaning, okay, now that we sort of got um, issue one out of the way and we've got a patient who is clearly motivated and healthy and doing all she can, now she needs my help to get that tummy to look the way she wants or to get her breast back to the way she wants. And she can't do that all by herself, that's for sure.
No, she can't. They need a renowned plastic surgeon like yourself to help that make that happen. So, we talked in the last episode about the evolution of the medical field. We'll talk about it again now for this different topic of conversation of mommy makeovers. How has the perception of mommy makeovers changed over the years among women and in the general public?
I think as surgical techniques and experience have evolved with an overwhelming emphasis on patient safety, I think the public has become more and more comfortable with the idea that plastic surgery is available to them, including that category of mommy makeovers. And if it is financially available to the patient and she believes that emotionally this would go a long way toward helping her feel better about herself, then thankfully, this day and age, it's extremely safe. in the hands of a skilled, board certified, experienced plastic surgeon. Now, complications can occur, and what distinguishes a skillful and experienced surgeon from a waiter or a server in a restaurant is the server in the restaurant is sort of obligated to deliver whatever it is you ask him or her to deliver. I want number six on the menu. And the server can advise you a little bit. Well, I think number five is a little better. I'd go with number five instead of number six. But we as plastic surgeons can't simply act as a delivery service. The patient wants a breast augmentation. She might not be a good candidate for it. So this is where our judgment and experience and guidance is extremely important. The patient may be asking for something that is not attainable. And so it's clear that the doctor hat is right there simultaneously on my head as the plastic surgeon's hat to really give the patient good advice. And I will tell you, Neil, that education is key. There is a tremendous amount of information out there, whether it's through influencers or social media or the internet. And I would ask all of our patients to be very, very mindful of the fact that some of the information that might be receiving is woefully inaccurate. In fact, it's wrong. And the best source for information, if not through our website, would be through the national websites for aesthetic surgery, which include the American Society of Plastic Surgery. Their website is plasticsurgery.org, and the American Society for Aesthetic Plastic Surgery, which is simply surgery.org. And those are two very, very useful websites for patients who want to start their journey with regard to exploring. And then when it comes to regionally where they should have their surgery, we're of course uh, uh, a uh, a very experienced plastic surgery office. I've been in practice now for nearly 35 years and involved in all aspects of both reconstructive and aesthetic surgery of the face, breast, and body.
Sure. So there are more questions that I have about this topic of mommy makeovers that we'll get to in a second. But I wanted to follow up on that on that talking point you had a second ago about how you have a doctor's hat and how you have a plastic surgeon's hat. There also seems to be a bit of a good Samaritan hat on you as you are educating your patients and prospective patients on what you truly believe is best for them. Why do you believe that's so important?
You know, that's a great question, Neil. And some doctors, um, unfortunately, feel a little challenged by the educated patient. I feel energized by the educated patient because if a patient has taken the time and the effort to get educated, that tells me that this is a motivated patient. This is someone who's intelligent, who is going about making important life decisions with the proper um, investment of time that such a big decision ought to have. And so I love it when my patients are educated. And one of the things that is, I think, the source of anxiety for any medical issue, but certainly for surgery, and particularly for elective surgery, when the patient feels, oh, gee, should I be doing this? Am I putting myself in danger? Is this irresponsible to my partner or to my children? Because, you know, this is just for me, and am I being selfish and am I being vain? And I think all of those questions are completely legitimate. But the good news is, Neil, that in this day and age, we are very skillful in performing safe surgery that can achieve amazing goals and meet the goals of the patient. And my own feeling is that a lot of anxiety comes from the unknown. And if the patient does their research through the internet, I certainly welcome that, but I caution all of our listeners to be careful and be really judicious about knowing that their sources are reliable. I don't necessarily consider influencers reliable. I don't necessarily consider neighbors or girlfriends as reliable because they had a unique experience that may have been good or bad, but that is not necessarily the final answer. And the real true information comes from objective sources, not subjective sources. So, I pride myself in being as objective as possible. I don't try to sell any of our services or try to convince my patients to undergo surgery. I want to answer all questions. I want to make sure that they are fully informed, and I want to make myself available to the patient who feels that I can be of service to her.
And that's very admirable. It really, really is. Because as a doctor, in a sense, you are a scientist of sorts. Your data is pulled from scientific studies, and you feel it is very important for you to be providing that scientific data to your patients. So, very, very admirable on your end, especially in an elective surgery driven world as a mommy makeover. And let's go back to that for a second. Can you talk about a couple of success stories that stick out to you that you think really highlight the transformative effects of a mommy makeover on the life of one of your patients?
Honestly, Neil, the patients who come to us for mommy makeovers know why they're coming. And when we go through a mommy makeover journey for a patient with a well planned, um, carefully executed surgical treatment plan, and it might involve things other than surgery as well. Um, Thankfully, the vast majority of the patients, if you sort of exit poll them, probably 99% would say they're thrilled with their result and they would do it all over again. So I'm happy to share that historical fact with you and with our listeners that this is really very highly predictable. I remember one cute story that your listeners may find kind of fun. I remember a young mom who came to see me. She'd had a couple of kids, and she actually had a tattoo around her belly button that were sort of like they looked like either the rays of sun or sort of like flames. And when I examined her, the first thought that came to my mind, she was definitely a good candidate for a tummy tuck. But when we do a tummy tuck, we're sort of tightening up the extra skin below the belly button, and some of it is above the belly button, but we keep the belly button in the same location, but the skin that was attached to the belly button moves south. So the first thought that I had was I may not be able to get rid of all of those flames or rays of sun, but I'm pretty sure that when we're done with the tummy tuck, those flames or rays of sun are going to come right out of her panty line or bathing suit. And we both chuckled about that. And she said to me, "Oh, I think that's okay." So we had a good laugh about that.
Yeah, it's always good when you can find humor in these types of situations because that is a very humorous end to that story for sure. So we closed the last show by talking about what kinds of advice you would give to women in the situation that they find themselves in with a breast cancer diagnosis. And let's close this show with the same exact question. Obviously, it's a little bit different. They're talking about a mommy makeover being more of an elective type of surgery than a breast reconstruction after a cancer diagnosis. But same question, what advice would you give to women who are hesitant about undergoing a mommy makeover but are considering it?
Right. Well, I think the hesitancy comes from some of the things we touched on already, namely, am I being vain? Is this frivolous? Um, am I putting myself in danger with regard to my kids? And like I said, today anesthesia techniques and surgical techniques are extraordinarily safe. And the likelihood of the patient having a serious complication or, God forbid, death are infinitesimal. I mean, they are just so small. I don't want to completely minimize the fact that general surgery and anesthesia, excuse me, surgery and general anesthesia are serious and important undertakings, but thankfully they're extremely safe. We do them on a day in and day out basis with a high degree of predictability. And the number one consideration that we always have, regardless of what service we're offering in our office, is patient safety. Patient safety is number one through 10. And so that reassurance is hopefully something that I can um, transmit to your listeners. And then the other thing is, remember what we do as plastic surgeons. We impact on quality of life. We're not saving lives. You know, we've got emergency room doctors and cancer doctors and trauma surgeons who are saving lives every single day. We affect quality of life. And if the patient is walking around relatively healthy, but is bothered by something that a plastic surgeon can help her with, that's the reason to come and see us. And like we said at the start of this discussion, Neil, uh, having children is one of the most gratifying experiences us human beings can go through. And that's particularly true for mothers. But there's a price they pay. And if the effects on their body were more than they'd hoped for, or it's putting them in a state of psychological well-being that is not optimal, and we can correct that with a fairly simple, straightforward outpatient surgical procedure, then that's something that she is certainly invited to explore.
For sure, for sure. I mean, all that makes sense. It is an elective surgery, like we said a moment ago, as opposed to the last episode that we did about breast cancer reconstructive surgeries. But at the end of the day, we are talking about sculpting the soul. That is the name of this show. That is, I think, the essence of what we're talking about. We're talking about operating on human beings and it being a very, very strong benefit to their emotional state as well as their physical state. So, Dr. Ram Kalus, we're always thankful to have you on and break down the intricacies of these procedures and their emotional benefits. Where can people learn more if they want to learn more about you?
So, our website is really simple, drkalus.com, Kalus, and we are very proud of our practice in Mount Pleasant. I've been in practice for over 35 years, and there's really good information on the website. They can also visit our larger website called plasticsurgerycarolinas.com and excuse me, plasticsurgerycarolina.com. That's without an S. And they can, of course, contact our office to schedule an appointment, and we'd be more than happy to get them in and get these questions answered face to face.
Well, that's sometimes the best gift you can give is just education. Dr. Kalis, thank you as always so much for joining us today on Sculpting the Soul. And remember, as we wrap up today's episode, beauty is not just about physical looks, it is about your confidence and feeling your very best. So until next time, embrace your own journey and stay true to yourself. Dr. Kalis, a pleasure as always.